Namaste, I'm Dr. Maya Varghese, Ayurveda surgery and parasurgery specialist at AyurVAID Hospitals, Hyderabad. Have you ever experienced pain, burning, or bleeding when passing stools? Or perhaps that feeling that something is coming out of the anus? Millions of people suffer silently from a very common condition called piles, also known as hemorrhoids. Let us see how piles develop and what exactly causes them. Inside the anal canal, we have soft cushions made up of blood vessels. Their purpose is simple. They help ensure the smooth passage of stools and maintain continence. The problem arises when these blood vessels become swollen and stretched and congested. That is when they turn into piles. In simple terms, piles are essentially swollen veins in and around the anus, very much like varicose vein you might see in the legs. Pile starts with straining during bowel movements. When you forcefully push, often due to constipation, significant pressure builds inside the rectum, slowly causing damage to the vein walls. Secondly, if the stools are hard, they injure these already delicate veins as they pass. This pressure and damage lead to poor circulation. Blood start collecting in the veins, leading to venous congestion, and the vessels begin to bulge out. Initially, piles remain internal, but over time they begin to bleed, and eventually, with repeated pressure, they may start to come out or prolapse during defecation. So, what is the main reason for piles? By far, it is constipation. This is often triggered by simple things like low fiber intake, not drinking enough water, and irregular meal timings. All of this results in hard stool and straining. Beyond that, your lifestyle also plays a huge role. Prolonged sitting, long hours of driving, or even using your phone in the toilet are also some of the main reasons. Strenuous activities like heavy lifting and gym training are other major factors. We can also see piles commonly in pregnancy and in obese individuals. Now, what are the early warning signs of piles? If you notice symptoms like bleeding during stools, burning or itching at the anus, pain while passing motion, a feeling of incomplete evacuation, or something coming out during defecation, do not ignore them. The good news is that early treatment can prevent the need for surgery. AyurVAID treats piles by correcting digestion, relieving constipation, healing the swollen veins, and strengthening rectal tissues naturally. With medicines, diet corrections, lifestyle changes, and surgical procedures like Ksharasutra and Charadharma, the piles can be treated. See, piles are common, but suffering in silence is absolutely not necessary. With the correct diet, proper bowel habits, Ayurvedic therapy, and medical management, piles can be completely treated. Thank you.